Receiving a severe medical diagnosis triggers an immediate shock to the system. The human instinct is to drop everything. You want to get on a plane, leave your local doctors behind, and find the absolute top-ranked hospital on Earth. But looking at the global data, a stark paradox emerges in how we treat serious illness, especially in the United States. The U.S. deals with the highest cancer incidence rates in the world, operating within a deeply fragmented healthcare network. Yet it simultaneously holds the highest concentration of elite specialized hospitals. This chart outlines the critical decision you face: optimize local infrastructure or pursue a highly ranked specialized center. Chasing the specialized center comes with immediate friction, including significant travel costs, out-of-network fees, and long wait times. Effectively navigating your diagnosis means untangling those two things. You have to separate true medical necessity from prestige-driven panic. Let's look at the first path. A localized healthcare approach is built around prevention and early detection. When care is integrated directly into a community, problems are caught before they escalate. This early intervention shifts survival statistics heavily in the patient's favor. You can see this play out in the global numbers. India and Mexico report the lowest and second lowest cancer mortality rates among surveyed nations. They achieve these numbers through a systemic emphasis on education, tackling risk factors early, and keeping basic screenings accessible to the local population. In the U.S., the equivalent relies heavily on your primary care physician and regional health networks to catch common issues, like breast or prostate cancer in their earliest stages. The trade-off here is blunt. Because the infrastructure is fragmented, the quality of your early detection often depends on your zip code. But if you do have access, local infrastructure is highly efficient. For a standard, early-stage diagnosis, survival does not require a world-renowned hospital. Sometimes preventative care is bypassed entirely by external factors, forcing patients into that second path, reactive, high-tier intervention. Severe environmental carcinogens directly drive spikes in mortality. In China, pervasive air pollution is a major factor, making lung cancer the leading cause of cancer-related death there. Population-level lifestyle choices act as a similar trigger, inflating the number of diagnoses systems must handle. Look at France. A nearly 26% tobacco usage rate contributes to their position as the country with the second highest overall cancer incidence. When populations face these risks without robust early screening, the results are deadly. Data from both Russia and China show high rates of gastrointestinal cancers that routinely go undetected. This is known as late-stage presentation. By the time the patient experiences symptoms, the disease has already spread, narrowing the window for successful treatment. When systemic risks and delayed screening force a late-stage presentation, the math changes. Even the most advanced technology at elite hospitals offers diminishing returns on your chances of survival. However, if you are hit with a highly complex, rare, or late-stage diagnosis, local care might lack the tools you need. This is what the Newsweek and Statista global specialized hospital rankings are designed to identify: the facilities built for the most severe cases. For oncology, the absolute pinnacle of this intervention model includes places like MD Anderson, Memorial Sloan Kettering, and the Mayo Clinic. At these institutions, you are buying access to cutting-edge clinical trials, experimental technology, and rooms filled with concentrated expertise. To evaluate if this intervention translates to a better life post-treatment, these rankings now measure PROMs, patient-reported outcome measures, which track the actual quality of life outcomes driven by the hospital's care. Accessing this tier requires enduring significant friction. You have to battle U.S. healthcare bureaucracy, cross state lines, and absorb out-of-network costs. There is also a hidden medical risk. Elite centers use hypersensitive screening tools that often find microscopic abnormalities, leading to the treatment of non-lethal issues that would have never caused a problem. Uprooting your life to enter one of these facilities is a significant logistical and financial investment. You only make that trade when highly specialized expertise is the singular path to survival. Making the right choice requires matching the severity of your specific diagnosis directly to the level of logistical friction you can safely endure. This chart maps out that decision, plotting the severity or rarity of a diagnosis on the x-axis against the logistical friction required to treat it on the y-axis. Down in the lower left quadrant, we have the pragmatic patient. If you are dealing with a standard early-stage diagnosis, staying local and optimizing your regional health network yields high survival rates, keeping your financial stability intact and avoiding life-disrupting travel. Up in the upper right quadrant sits the resourced optimizer. For rare or highly complex conditions, the return on investment for paying the premium in time and money to reach a top-ranked facility is historically validated. Effective healthcare relies on deploying the specific level of intervention your medical reality requires, rather than reflexively seeking the most famous brand name. The core tension in this system is between relying on accessible, preventative local infrastructure and chasing reactive, elite intervention. Taking control of your personal health requires you to make cold, calculated logistical decisions exactly when you are under the most emotional stress. Global hospital rankings are incredibly powerful tools for specific, complex scenarios, but they cannot replace the foundational necessity of strong baseline infrastructure and early detection. Surviving a diagnosis, and the healthcare system itself, requires knowing exactly when to trust your local community resources and exactly when to uproot your life and fight for elite care.